What if you had X-ray vision as your superpower? Careers in diagnostic imaging can help diagnose and treat a variety of injuries and diseases. Let's learn more about the career opportunities at Lake Regional Health System.
Lake Regional Health System was built to deliver exceptional care. Our expanding team renews this commitment every day and will continue this commitment for generations to come. We consider it a privilege to offer our ever-expanding capabilities to our friends and neighbors in Mid-Missouri. From comprehensive orthopedic care to 24/7 heart attack response and our nationally accredited cancer center, we continue to strive to meet the growing needs of this shared community. One of the areas of healthcare that we continue expanding is diagnostic imaging. Whether it's a 20-week anatomy scan in our family birth center or a life-saving echocardiogram in the emergency department, our healthcare professionals at Lake Regional depend on diagnostic imaging to diagnose illnesses and injuries, monitor treatment, and screen for diseases. Did you know that ultrasounds are performed in multiple areas of healthcare and take images of all areas of the body? My name is Mandy Bargfried, and I'm the radiology manager here at Lake Regional Health System. Following high school, I went to Iowa Central Community College, where I entered into the radiography program. While I was there, I also had scholarship to play basketball and softball. So I attended classes and practices and games. My husband and I decided to move to Lake of the Ozarks. I applied for a position here at Lake Regional, and I started off just a PRN employee working as needed, and that moved into a full-time position working the night shift. Over the course of my 17 years with Lake Regional, I've been able to cross-train in several different areas of our health system, including mammography, CT, bone density, our cardiac cath lab, and now I'm in management. Diagnostic imaging provides many career opportunities within healthcare. This is Laura. As a sonographer, she performs ultrasounds throughout the health system. Take a closer look as she performs a 20-week anatomy scan at Lake Regional Family Birth Center.
So here's baby right here. You can see baby's heartbeat, and then here's baby's spine going across the top of the screen. Aortic arch right here coming all the way down through baby. Baby is in the breech position, so head is up here, bottom down here, and baby is facing your spine. There at the bottom, there's baby's feet. Right there, did you see it move, kick? So there's toes. And then heels right there, and then other foot is there too. So there's both arms. Hands are up together by the face right there. And then there's the start of baby's face, front on. We evaluate all of baby's anatomy, so making sure baby has 10 fingers and 10 toes. Heart looks good. We look at the brain and the brain structures. We do measurements of baby to make sure that baby's measuring right with what your due date will be. We evaluate placenta and then the uterus as a whole. We also evaluate the umbilical cord. We watch it going into baby, and you can see it here going around the bladder. We look at it going into the placenta as well. We can see what baby's heart rate is. Got baby's heart rate at 158. So here I'm measuring baby's head. That's one of 3 measurements that we do to evaluate baby's weight. I'll measure the abdomen as well. And then we measure the femur too. So that is baby's femur right there. I love the variety of ultrasound, that I don't do the same thing every day. There's all different types of exams that I can do, from OB, vascular, general ultrasound, looking at livers and gallbladders. Every day is different. I thought I was going to be a physical therapist until I job shadowed, and then realized that wasn't for me.
Ultrasound is used in several departments throughout the health system, not just in pregnancies. Diagnostic imaging plays an important role in providing time-critical care for trauma, stroke, and heart attack patients. This is John. His patient just came through the emergency department after a cardiac event. He is going to perform an ultrasound of the heart to help our physicians diagnose and treat the patient.
This is one of the first views we look at to assess the heart. We can see the function of the heart muscle squeezing in toward my finger. You have a valve in view here that is opening and closing, you can see. We can assess and track red blood cells through the valve and the chambers with this color. It's called color flow Doppler, similar to what's used in weather radar when they're giving you a weather map. Currently, we're measuring the volume of her left ventricle to assess her cardiac function and output. We do these measurements to allow the doctor to come up with conclusions on overall function of the muscle of the heart, its ability to pump and supply blood to the body. That sound you're hearing, of course, is the cardiac cycle. What we're looking at here is the left ventricle, the muscle. We're actually looking through it as if we had a Coke bottle in front of our face, and we're going through it in different segments as we drink the Coke.
Having athletics be such a large part of my life, I had some amazing coaches that really left an impression on me, and now as manager I get to channel that coaching energy into developing the next generation of diagnostic imaging professionals.
My name is Megan. I am the sonographer at the Lake Regional campus in Lebanon. I went to X-ray school at Missouri Southern State University. When I was trying to decide what I wanted to do as a career, I started job shadowing. I actually got to job shadow my now office manager, Mandy, and she got me on the path to X-ray at Lake Regional. They asked me to become a sonographer, and that was really the only modality outside of X-ray that I had interest in for myself. So I agreed. I went to Washburn University. It was a 2-year program. There's so many credentials that you can have after your name. There's so many registries that ultrasound can take. When you work in diagnostic imaging, whether you are in ultrasound, you're in X-ray, you're in MRI, no body is the same body. So literally every day is something different. I would encourage that anybody in high school looking for a career path that suits them to job shadow. Always job shadow, always ask questions, always do your own research. Whenever you're in a program, ask your professor if you can choose the place that you do your clinicals at. If that's somewhere that you would potentially like to work, that can get you a foot in the door. It's always good to do your clinical somewhere that you would like to work, because you already know the machines, you already know the equipment, you already know the people, and they know you. For 2 years, from day one to the day I graduated, I did all of my clinicals at Lake Regional.
My name's Ethan Kusick. I'm a second-year X-ray student at East Central College in Rowell, Missouri. During my first year at college, I had no idea what I wanted to do, so I job shadowed a bunch of different fields. While job shadowing in radiology, I realized that this is something that I could definitely do every day. I currently work at Lake Regional as a student tech in the radiology department. I work side by side with registered techs, and they help me learn daily. Something that's awesome about this field to me personally is that once you get out of X-ray school, there's so many different directions you can go. I plan to learn CT. In May, I will graduate with my Associates of Applied Science in Radiography. Because I am currently working as a student tech, Lake Regional has offered me a full-time position in May when I graduate. I'll be working as a CT tech in training in that modality. If any of you have interest in this at all, the first thing I would do is job shadow. This will really show you if it's something that you want to do. I mean, you might get in there and think, oh man, I would never want to do this, but that would be the first step. I'm super pumped with my career choice and how it's been so far, and I'm very excited for my future in radiology.
At Lake Regional, we want to be a resource for students who are interested in learning more about diagnostic imaging careers. Students could witness our team in action by applying to become a junior volunteer or to job shadow. We hope that someday you'll join our knowledgeable, dedicated team of people who care for patients and each other at Lake Regional Health System. Our commitment runs deep.
And now live from Lake Regional Health Systems, our diagnostic team. You have the diagnostic floor. Welcome to Healthcare Career Day.
Thank you. We're happy to be here.
Why don't you go ahead and share a little bit more about how you got into this fascinating world?
Sure. So my name's Mandy Barkfried. I'm the radiology manager with Lake Regional Health System. I have been with Lake Regional for almost 18 years, coming up in May. I originally from Iowa, moved down to Lake of the Ozarks shortly after graduating from school. And so I had about nine months under my belt working in general X-ray. And when I got down here to Lake Regional, I was working in general X-ray just as a PRN employee as needed. When other employees would take vacation, then I would jump in and take their place doing the x-rays for them here at the hospital. And shortly after that, it turned in, there was an opening on the night shift. So I took that position and was able to work myself into a full-time position. Nights, learned CT. And then from there, I went on to learn mammography, and I worked in the cardiac cath lab, taking call and doing those emergency studies when patients come in actively having a heart attack, and worked in that area for about 4 years. Then I decided that I was going to go back and work in the mammography world again. So I did mammography for another 3 years, and then got into some leadership role with the general x-ray department again, and that led into the management position. And so that's where I'm sitting now, and feel that I'm very blessed to be in this position where I can mentor the team and help them in the day-to-day operation of diagnostic imaging.
My name is Megan. I'm one of the ultrasound technologists here. I work at the one of our clinics. Just like Mandy, I have worked here. I'm going on 12 years now. I started in X-ray. I did not do my clinicals here, but I job shadowed here. I followed Mandy around. I did all of my clinicals here for X-ray and for sonography. And then once I became an ultrasound technologist, I have continued to work here ever since.
Fantastic. Megan and Mandy, great to have you here. We actually have some students that are wanting to ask questions live. I think if we have them pulled up, we have Jefferson College HOSA, chapter down in Hillsboro, Missouri. Welcome to Healthcare Career Day. Go ahead and ask your question.
Hey, our class was wondering what type of classes a student could take in high school to help prepare for a career in sonography or ultrasound.
Great question.
Great question.
Yes, it is. So I'm not sure what kind of classes your high school provides. In my high school, I took classes like anatomy and physiology, biology classes, and then once I went to college, I also took anatomy and physiology and physics. You don't think that you need physics, but physics is a very big role in ultrasound. There is a complete registry that you have to take before you can take any other registry in just physics. So physics, physical science, all the science classes, you can never go wrong with any of the science classes.
And I'll echo what Megan said as far as the classes that are offered in high school. I know some schools offer dual credited courses where you're going to get high school credit and some college credit. One of those might be medical terminology. That is a class that it's 101. You've got to have medical terminology to move forward and progress in healthcare. And along with physics, chemistry, those go hand in hand, and what we do in diagnostic imaging. So if those are classes that interest you, definitely look into diagnostic imaging, because that's what we do on the daily.
Great question, Jefferson College HOSA. Couple questions have come in on the Q&A. What is the coolest thing you've ever seen in ultrasound?
There's all kinds of things that we can see. In my line of work, I scan everything except for hearts. I don't do echocardiograms. I have seen them and they are really cool, but I scan babies. They're really cool. I scan veins and arteries in the legs, which is probably my favorite. I just think that it's cool to see how blood flow gets to places, how your organs function, how every organ is different from the other, how blood flow to your feet is different than blood flow to your kidneys. that's fascinating to me. So I would say just watching the blood flow, watching what can hinder the blood flow, and then how the surgeons can go in and fix all that. And then I can scan them again and see the difference from a pre-op patient to a post-op patient.
So to help you all with maybe a visual of that, what Megan's describing is if you thought about a river flowing and all of a sudden the river got dammed up and it stopped the flow of the water, that's the same as a blockage in your vascularity. So the blood's flowing through, you get a blockage, it dams the blood up, and so it doesn't flow down your extremity. And so Megan can see that under ultrasound, and then we send the patient to have that treated, and then she can scan the patient after that treatment's been done, and here we go with the river flowing again.
And we need that river flowing, right? Blood
That's
to the
right.
brain, blood to the heart, and everywhere else in between, right? A follow-up question, we actually came in on babies, and when you're looking at babies. So Amanda from Lebanon High School asks, how are you able to detect deformities or disabilities on infants in the womb? Good question, Amanda.
With ultrasound, you do so many ultrasounds that you see normal all the time. So when you see something not normal, it's plain as day. You can see not normal. There's a lot of times that we don't know what has caused that. There's so many different things like trisomy 18, trisomy 21. There's different things that can hinder the growth of a baby in the womb. We may not always know what condition this baby has, but we can see this baby can have hydrops, which is there's different conditions with hydrops. We can see if one arm is longer than the other, if one leg is longer than the other. We can see if a club foot, a baby has a club foot, or if they have what they call a rocker bottom foot. Like I said, we see normal so often that it's easier. It makes it easier for us to see what's not normal. So we can, you scan enough and you see enough, you'll know what's not normal and what is normal. And then you just keep looking, and eventually you will find out if everything is good, which is great. And then if everything's not, unfortunately, not so great. Absolutely.
And you know, that's the great thing about technology today is we can actually see inside the body. If you think about what would this look like 100 years ago when you're trying to diagnose somebody with an ailment in the 1920s, you wouldn't be able to see like we can see today. Even in 1980, you couldn't see what you could see today with diagnostics. One last question for you before we have to move on. Let's see, Ron Perry's class asks, what do you find most rewarding about being an ultrasound sonographer technician?
There are a lot of rewarding things. One of them is to watch a family that has been so excited to have a baby. They get to see their baby for the very first time up on the screen whenever you scan them, or whenever you have a patient come in with a pain and they are so scared about cancer or a tumor or something, and we can't give them results, but we can help them get through the exam. We can help calm them. And it goes a long way to think that you are part of caring for that patient. You are part of making the journey for them a little bit better, hopefully, a little bit easier, and a little bit more calming.
Fantastic. You know, that's just a perfect example of why you go into these type of professions in healthcare, is that you can really make a difference in somebody's life, regardless if you're a frontline nurse, radiology, or even working in something like EMS, that you can help somebody daily. So thank you so much for joining us, Mandy and Megan, for coming into Healthcare Career Day. We'd love to stay and chat. We have more questions we'll have to send to you afterwards.
That sounds great. Thank you for having us.